So I've been doing research primarily on FND, functional neurological disorder, but over time, over that period of time, it became increasingly clear to me that many of my patients with FND also had problems with their bladder. And in particular, some of them had problems with urinary retention, so being unable to pee. And when you can't pee at all, then one of the common causes for that is Fowler syndrome. So I'm aware that we've got people on the call here who have Fowler syndrome, perhaps know quite a lot about it. And there are people who, but perhaps don't know about FND. And there are people with FND on the call who have probably never heard of Fowler syndrome. So I'm going to spend about 20 minutes or so talking about these two conditions, particularly FND, because it's for the Fowler syndrome UK group, but a bit of both, and how they might overlap and what perhaps these two conditions tell us about each other. So just some basics here really so functional neurological disorder is a subtype of what we call functional disorders, which are really common in medicine and include things like irritable bowel syndrome. And what do I mean by a functional disorder? I really just mean a disorder where there's a problem with bodily function rather than structure. So these are often conditions that you can't see on scans because scans don't show the way that the brain and nervous system is working. So we often use an analogy that it's like a software problem or versus a hardware. So a bit like when that horrible blue circle goes round and round on your computer. Or if you don't know about computers, it's like a piano that's out of tune. Nothing actually broken in the piano, but it sounds horrible and it's clearly something wrong with it. So that's what we mean by functional disorder, and I'll come back to this. And if you look across medicine at what people actually have wrong with them when they're ill, these things are incredibly common, particularly if you count symptoms. Not everything is a disorder, but up to a third of visits to your GP or hospital clinics are for symptoms and disorders that turn out to be these functional disorders, but they're really hidden and they're a bit stigmatized and people haven't heard of them and medical students aren't taught about them properly. So we've got quite an uphill struggle to get these conditions properly recognized, partly because you can't see them on a scan. And FND, functional neurological disorder, doesn't describe all functional symptoms. Here's a list. Here's a list of some functional symptoms. Well, the FND ones would be things that a neurologist might see, like weakness or paralysis, tremor, seizures, numbness, that sort of thing. Maybe dizziness, maybe cognition. So it's the kind of things that are more typical in a neurology clinic. Although really all of these symptoms come from the nervous system, ultimately. So I hopefully don't need to tell this audience really that FND, even though you can't see it on a scan, is really disabling and it's real. And it's actually pretty common as well. Definitely one of the commonest things that we see. And this is a video of Rachel, who's a patient with FND, and this video was taken about a year after she started to develop this weakness down her right-hand side, who's a student. And she's got weakness, but she's also got some twisting of her hand. It's called dystonia, and the foot's turned in a bit. That's dystonia. And you can see how disabled she is here in this video.
In an ideal health service, all doctors and professionals would be actually made aware of this. We wouldn't be treated as though, not like we're faking, but almost like as though it's not real. And that doesn't really help us because we're thinking, oh, what's wrong with me?
And if you've got Fowler's, that might be a familiar feeling that, you've got a problem, but people are finding it hard to show what the problem is on a test. So the thing about FND, which is actually not something new, we knew this 100 years ago, but we have sort of rediscovered it, particularly in the last 20 years, is that it's not a diagnosis you make just because the tests are normal. That's a really bad way to do medicine, and you can make lots of mistakes if you do that. What we've shown is that there are lots of typical features of FND that only people with FND have. So you look for them, see if they've got them. If they've got them, then they've got FND. They might have something else as well, but these signs do tend to mean that they have FND. So this is Rachel. I'm examining her, and what you'll see in this video is she's got weakness in her right leg, and when she tries to push against my hand, her leg is weak. But then when she pushes against with her good leg, the weak leg comes back to normal transiently. Now, it's probably easier if I just show you. So can I just get you to push against my hand here? And we can see when we do that, you're stronger than I am, and I can't push that knee in. And then let's try and do the same thing with this knee. So stop me from pushing in, push out as strong as you can. But I'm winning there, pushing your knee in. Let's go back to this side. I want you to push out again as hard as you can. Really stop me, push, 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 push. Now when we do that, we can see that actually what's happening over on the right side is that it's become much stronger and I can't push the knee in now. So it's brought out the automatic movement. So when I do this in clinic, patients are quite amazed really, because they can't move their leg. And in fact, the more they try to move it, the worse it gets. But when you do certain maneuvers, it brings out these automatic movements, and the automatic movements are okay. So that shows that it's not due to damage to the nervous system, but it is a problem with the software of the nervous system. That means it's a functional disorder. So we've got a whole range of these tests for symptoms like leg weakness or tremor, or typical features of seizures or numbness that enable us to say that this person has FND. And we need to look at the problem that way. And the reason we're talking about FND to Fowler syndrome UK is because a couple of studies actually led by Ingrid, who's just been speaking, showed that about 1 in 4 people with Fowler's have a history or have FND problems. And it may even be a bit higher than that, because we haven't necessarily looked that systematically. Certainly, and looking at it the other way around, if I sit in my FND clinic, I would say up to 1 in 10 patients have problems with their bladder. And very often it is this problem with being unable to pee or finding it difficult to pee. We call that bladder voiding dysfunction. So it does seem to be unusually common in Fowler syndrome, because it's not, although it's quite common in neurology, it's not affecting 1 in 4 people in the UK. So FND has a difficult history, and it's one of the reasons it's been a kind of invisible illness. In the 19th century, patients with FND were said to have hysteria, which is a really difficult word to even say in front of this audience. But I think it's important to understand where all that stigma comes from and why doctors behave so badly very often towards people with FND, because it's got this history. So we recognize similar symptoms and presentations in the 19th century. FND was what some soldiers had in World War I when they were diagnosed with shell shock, and that was quite a change, because they realized anyone could get FND really under certain circumstances. And it also emphasized the importance of stress for some people, but also injury. But this is me back in 2004, as a junior doctor with my family, doing a PhD on this topic, people with functional limb weakness. And things have changed a lot. So this is me now with my family. They've grown up, and over that time, things have changed a lot, because this is how many people, I would say most people with FND were treated 20 years ago. And I appreciate that is very often how they're treated now as well. So I'm not saying this has all gone away. But patients with FND, because the scans are normal, they're often told there's nothing wrong. They're told it's a psychological problem. Your tests are normal. I don't need to see you anymore. So that was the sort of standard response when I was training in neurology. And patients with FND have often had really bad experiences, felt dismissed, disrespected by health professionals. This was a survey done by FND Hope, which I'll mention later again, just showing how many people with FND have had those experiences. Like most of them, 9 out of 10 people have had negative experiences. So I recognize that still goes on, but things are slowly changing. Now, I said there that doctors would often say to patients, this is psychological. And I've mentioned shell shock as well, World War One, where so terrible things happened to soldiers and triggered FND. So there's no doubt that psychological stress, psychological trauma is a risk factor for FND. And if you look at people with FND as a group, they have higher rates of recent stress, also higher rates of stress in the past, maybe bad things that happened to them when they were growing up. But it's not everyone with FND, and it is really it's a risk factor, not the cause of the condition. So it's a bit like people with stroke. You might say that smoking is a risk factor for having a stroke. It is, and you might ask someone with a stroke whether they've been a smoker. But if they haven't been a smoker, then they've still had a stroke, just without smoking. And it's the same story with FND, really. So one of the problems with FND is people thought that every single patient who had FND must have had a terrible thing happen to them or been stressed. And that was the only problem, and that was the only thing that needed to be treated. So I think we went wrong there in the 20th century, looking at it that way. But we shouldn't ignore stress, and we shouldn't stigmatize psychiatry or psychological factors, because they often are relevant. But it also turns out that just as important are lots of other things that people have. Physical health problems that seem to be a really strong risk factor for getting FND. So we've discovered recently that if you've got joint hypermobility, which actually 1 in 5 of the population have, that's probably a risk factor for FND. Just having carpal tunnel syndrome or migraine or epilepsy, really anything that gives you a neurological symptom can be enough to trigger off FND. And that's also been known for a long time. So it's called functional neurological disorder because we're saying that there are changes in the function of the nervous system. Is that true? Well, yes, it is true, because we've seen it. We can see it on research scans like this one. This is a SPECT scan, but also this functional MRI that show how the brain is actually working. So it's actually a way of looking at that software problem in the brain. And this is an example where we can see this area in yellow in the brain isn't working very well. And this is for a group of patients who've got this FND symptom, which is called hemisensory syndrome. So they can't feel anything properly down one side of their body. And it's kind of in the right place, this problem where the brain isn't working. So we can see it on a research scan, but we haven't got any types of scan to show FND in a routine clinical way yet, but maybe one day we will. And people sometimes have trouble with this, and they think, well, are you sure there's a problem with the brain? And my answer to that is, well, yeah, of course there is, because where else would it be going wrong? If someone can't move their arm or leg, or they're having seizures, what other organ in the body is it going to be? So doctors have been in the habit of sort of imagining that you could have these problems without there being a physical explanation in the body. Of course, there's a physical explanation. It's just not something you can see on a scan. It's to do with the way the nervous system's working. So I'm glad that things are changing in the UK. We've got a long way to go, but they have changed quite a lot. We've got this new FND society that I'm secretary of, and has 800 members internationally, and it's for health professionals. And FND's become one of the 8 core conditions that neurology trainees in the UK now need to learn about, which I'm particularly pleased about. So that's FND, and I've told you a little about why we're talking about that to Fowler syndrome UK, but let me just talk about Fowler syndrome a bit. So we're talking about this because 1 in 4 people, we think, have FND, Fowler syndrome. And actually, if you go looking for other functional disorders, particularly chronic pain, fatigue, irritable bowel, you're probably looking at 2/3 to 3/4 of people with Fowler syndrome having a functional disorder. So what does that mean? What does that mean for Fowler's? Well, again, the history here is difficult with Fowler's, and this is my Fowler's historical swingometer to try and think about that. So if we go back to the 19th century, and you had Fowler syndrome, people would have said that's a psychological problem. Right up to the late 20th century, they would have said this patient, normally a woman, can't pee for some psychological reason. That's how it would have been explained. And that obviously, you can imagine, caused a lot of upset. Although for some patients, interestingly, psychological treatments and other treatments did actually help. And that's something that I think perhaps is really important to think about. Now, Claire Fowler, who I should have put a slide about for Claire, because she did an amazing job in the 80s and 90s about really kind of rescuing this condition from a situation where it was really just being totally ignored. I think most of the time women just weren't getting any treatment at all. They were just getting a catheter. And what Claire did was recognize the problem. And Claire took the view that the problem had nothing to do with psychological factors at all. She found some changes on some tests that may be relevant, but also thought a lot about the physiology of what's going on in the bladder when a patient can't pee, and introduced sacral nerve stimulation, which is a treatment that those of you on the call who know about Fowler's will be very familiar with, which has been transformative for some patients, but not all patients with Fowler syndrome. So it was an incredible contribution. Now, but I hope Claire won't mind me just saying that I think we need to get that pendulum, that swingometer, just to swing back a little bit to the middle. Not all the way back to psychological, but back into the middle. Because what we're learning about Fowler syndrome and urinary retention, because Fowler syndrome describes chronic urinary retention, is that it's probably coming largely from the brain in a way that may have very similar mechanisms to people with FND. So here's a little, so this is the most complicated slide of the talk, and I'll go through it slowly. So what we think this is only what we think might be happening. We don't know. More research is required. But we think that the normal pathways in the brain which control the bladder are just not working properly, in the same way that they stop working when people have FND and they can't move a leg. Then something unusual happens lower down in the nervous system. There's normally a lot of chat between the bladder and the spinal cord, which goes on all day long, and it's amazing really that it works and keeps us continent and makes us void urine when we want to. But in this, something's going wrong with the signals from the brain in Fowler syndrome, and it seems to do something funny to this chat between the spinal cord and the urethra, the opening of the bladder. There seems to be too much activity there, too many signals going on, and the urethra becomes very tight and spasms and becomes tight shut. And that's why people can't pee. And because something about that means that the messages from the bladder back up to the brain also get shut down, and the brain just doesn't recognize that it's full. So there's a sort of bad feedback loop going on between the brain, the bladder, and spinal cord that's causing Fowler syndrome, but in a software way rather than damage. And this is what sacral nerve stimulation, almost certainly why it can help in some cases, because it's interrupting that loop. But there are various things that we think are relevant in Fowler syndrome to making that worse. So pain, particularly pain in the lower half of the body, in the back. You know that patients who present with acute back pain very often go into retention, even though there's no damage. So that's very interesting evidence for that. And similarly, we've learned from Ingrid's work, particularly, that drugs like opiates are very important. So things like codeine, dihydrocodeine can probably make, pregabalin probably will make bladder retention worse. Now, if you're on those drugs and you're listening, don't just stop them, because bad things will happen. But we think that they can make urinary retention worse. Many people who have FND or similar risk factors for FND have tendency to what we call dissociation. That's feeling disconnected from your body. It's another way of thinking about why the brain doesn't connect properly with arms and legs. So, and then injury and pain down here probably leads to a sort of reflex response. So there's a whole series of things that can influence this, and it varies from patient to patient. And some of these mechanisms are very similar to those that we see in FND. So we meet people, that's I think why we meet people who've got Fowler syndrome, and they've also got weak legs or functional dystonia in their legs and numbness, because it's a problem to do with the messages from the brain to the body. Now that's the complicated version. The simple version is, well, maybe Fowler syndrome is a disorder of nervous system functioning between brain and bladder. So in a broad sense, it may well be a functional disorder, just like FND. And we've really got to get away, I think, from this tendency that doctors have this, and it's throughout our society, to think, well, a problem is either psychological or it's neurological or biological. In fact, we've only got one organ in our heads, and there is no psychological bit and neurological bit. It's one organ, and it goes wrong in very often, even if there's a structural problem with the brain, then there's a functional one too. So functional disorder does not mean psychological. It just means what it says on the tin, as a disorder of function. And if we think of it that way and think of FND that way, that might open up things that we can do. So I wanted to talk a bit about FND treatments, because if you do have Fowler's and you've got FND, you might be thinking, well, what can we do about this? Quite a lot, I think, more than we perhaps used to be able to do. It doesn't mean everyone can get better. This is a website that I've made for people with FND. I made it in 2009, and it's been upgraded recently, which is great. And there's an app. There's a thing here called the FND formulation tool for people sort of trying to grapple with their symptoms and work out why they've happened. So you might want to use that if you've got FND. It makes a report which you might find is helpful communicating with your own doctor. Ingrid led this fact sheet on chronic urinary retention and Fowler syndrome, where we've explained some of these things. So if you want to recap some of this information, it's available on the bladder page of this website, Neurosymptoms, and and it's also on the fact sheet page. That's the formulation tool. So we have amazing patient-led organisations for FND, and there are many. We've got FND Hope here. I hope I've mentioned the other ones. Oh dear, perhaps I haven't. Right, okay, that's bad of me, because there are many great organisations. FND Action, FND Dimensions, FND Friends, all doing fantastic work for people with FND. I suppose I've highlighted FND Hope here because we've specifically done this webinar in collaboration with FND Hope UK and the amazing work that they do. And I wanted to show you this really as a sign of where it's come from a state of complete invisibility. There was literally no website for people with FND that's why I made one, because there was nothing. And now we have FND Hope UK. You can see Lorraine Kelly is the patron. These are the Niagara Falls and the CN Tower lit up in the colours of FND Hope, which I think is just incredible. What treatments are useful for FND? Well, we spend quite a lot of time explaining it to people, kind of as I'm doing now, because it's a really hard thing to get your head around. And this is Miranda, who has a functional gait disorder. I just want to let you see a bit of her video.
My mum was there filming at the time, and she thought that it was crazy. And then he just made it faster and faster, and that's when we discovered that I could run. I could go quickly, but not slowly.
So you can watch the whole video on Neurosymptoms. But this is Miranda, who's a primary school teacher, who suddenly found that she couldn't walk properly, but she found that she could run, which is really weird. But that's not weird for FND. That does happen. And this is, so you can see day 37, she discovered that she could run, but not walk. And it just talks about her journey with recovery, mainly using physiotherapy, but also understanding the condition.
Sam and I, we were in depth conversation, and then it wasn't until we were halfway down the street that we both realised that I was walking like normally.
That is a miracle.
And my biggest fear then was to stop walking. I just kept walking because I was like, if I sit down and stop, what if I can't walk again?
So that was a great story. That it was very nice that Miranda improved. I'm well aware that for many people FND doesn't improve. So I don't want to give the impression that it's easy. It's not easy at all. It's one of the hardest things to ask someone to do, is to retrain their own brain using therapy. I wish we had a better way of doing it, to be honest. And even when people try really hard, sometimes it doesn't work. So we see patients who make a really good recovery. We see patients where treatment doesn't help. And it's not just about physiotherapy. Psychological therapy can be really important. I mentioned that some people with FND have had events a bit like soldiers in World War I, and psychological therapy is really important to think through what's happened to someone, what their own personal risk factors are for this. Sometimes going back over those events is helpful, sometimes it isn't. But many patients with FND have depression or anxiety or post-traumatic stress, and all those things need to be addressed. Occupational therapy can be very helpful. This is Claire Nicholson, amazing OT in London, who's led a lot of work on this. We think that the physio and OT for FND is different to what it is for other disorders. And many people with FND have pain, as do many people with Fowler syndrome. If you haven't seen Tame the Beast, have a look at Tame the Beast. It's a great video explaining what we know about chronic pain now, new ideas about chronic pain. Flipinpain.co.uk I also really recommend, to understand that chronic pain is a volume knob problem in the nervous system. So I've been going on a bit too long, but I hope I've told you that functional disorders are really common and often disabling, and FND is one of those, and it causes those sort of symptoms: weakness, numbness, and seizures. And we diagnose it with typical features positively, not because scans are normal. And FND commonly seems to happen alongside Fowler's, and maybe it's got similar mechanisms. So we've got a lot to learn now. Don't have all the answers yet, and I hope that we'll find out more in coming years. This is our group in Edinburgh. You can see me and Ingrid, and this is Laura and Alan, who are both neuropsychiatrists. We've got physio, Sarah, PhDs, and lots of past and present visitors. So this, if you wanted it, I'll just leave up for a second, is a QR code that gets you to lots of scientific literature on FND if you're interested and wanted to delve deeper. And that's my Twitter handle, etc. So I hope that's been helpful, and looking forward to Q&A. I think we're going to do Q&A via the chat. So if you could put questions into the chat rather than unmute your microphone, because we've got quite a lot of people on the call, and we'll do it that way. Thank you very much.
Hey, John, thank you very much. And I know that Danny and I are working as well on getting the Fowler Syndrome UK, the big sort of study that a lot of people have been involved in, published. And actually, again, a lot of those findings are very similar in terms of kind of the overlap with FND and the chronic pain in about kind of half of people. So it's always a nerve-wracking to be the first one to put your chat in, but if somebody wants to start, I think that'd be really helpful. Or maybe even I can start by just sort of asking an unfair question. That's okay, John. So do you foresee physio or OT or psychological therapies as also potentially being useful kind of in FND, if we're thinking about it in this sort of brain-body interactive way?
Yeah. So yeah, also useful for Fowler's, I think you mean. Yeah.
Sorry, yes, exactly. Sorry, yeah. Sorry.
Yeah. Yes, absolutely. So I think that's where I think we've got to not get too ahead of ourselves, because we're a relatively early stage. But I think I'm really interested in some of the older literature from the 1950s and 60s, where they do describe some patients with what I think would have been diagnosed as Fowler syndrome, improving with therapies, improving with sort of biofeedback therapy and pelvic physiotherapy. I think we've been in a situation where for a very long time, people had just given up doing any, on the idea of therapy for this problem. And just, before Claire Fowler, we're just putting catheters in. And then we've got SNSS, we've got sacral nerve stimulation, which is great. But I wonder if we need to try again. And it might not be, it's going to be hard, isn't it? I don't think if it was easy, we would know that physio and other things would help. So any changes, improvements to Fowler syndrome are going to be hard, but I think they take time, a long time in FND. So I think it's worth exploring these possibilities and also finding out more about people with Fowler's. Do they have a similar profile overall to people with FND? Is a similar proportion who've had those bad things happen? Are those bad things relevant? These are questions we've just got to find out.
We've got some really good messages coming through. Thank you, everybody. So from Lynn, she said she was diagnosed with FND in January, always had problems with her bladder, but since the diagnosis, her bladder's just given up and she's now having to self-catheterize. I think that's a pretty common.
Oh, sorry, you still there, Ingrid?
Oh, sorry. Oh,
Yeah.
sorry. I was just going to say, I think that's something that we would see in clinic. I'm not sure. Yeah. Lynn hasn't asked a specific question, but I suppose the question is, as she gets treatment for FND, would we be hopeful that the bladder symptoms would sort of improve, or what's your sort of experience with that?
Yeah, well, this is something we've been looking at. I mean, I have met a few patients where their bladder symptoms have improved. I guess there's a difference between your bladder giving up completely, as it seems to be the case with you, Lynn, and your bladder having difficulty peeing. I think if you've got difficulty peeing, that I see that quite often improving again. And it's interesting, from my perspective, it's interesting that if we can help someone's pain and mobility and leg weakness, I've quite often seen that the bladder seems to improve with it, which is kind of what you'd expect, really. Yeah, I think it can improve, but I think we don't really know. It's a bit difficult to know where to begin with other therapies at the moment for complete retention. But I think we're really interested in exploring whether they might help. And in fact, Ingrid and other members of our group have been doing quite a lot of work on that, with surveying pelvic physios about their experiences.
Brilliant. Yeah, and Lynn has come back later on and just had said as well about Botox as well, and how, again, I mean, I think that's the problem, isn't it? Is that some of the treatments are working really well for people and some of them aren't. And again, that's why we're so pleased that Danny's interested in this overlap and that so many people are kind of tuning in and things to see, are there other options? Are there other things that we're not thinking about at the minute? Because, again, if we just trying to put everything in together. Emma, I think, is asking a really good question, but I'm not sure if you'll be able to answer, just in terms of, do you know why retention might be worse sort of as the day goes on?
Gosh, I don't know. I don't know that at all. I'm sorry.
Yeah.
Other than lots of things get worse as the day goes on, fatigue, headache, but I can't really answer that. No.
Yeah. And then Jess has said she was diagnosed in 2014 and can't access physio or cryotherapy, and her disability is just getting worse. And she's just having a lot of trouble accessing help. And I think that's particularly with the FND rather than the Fowler syndrome. Yeah.
So I'm aware that services are really patchy for FND. There are some places where they're interested, like we are, but even people, I think it's important to say, even if you live in Lothian, maybe someone in the call, it's not the all singing, all dancing service that we would want yet. People still have to wait quite a long time to see us. They have to wait a long time for therapy. And I'm aware that lots of people live in places where no one seems interested. And I get, that's why I get emails a lot. And unfortunately, I can't help because I need to see NHS patients in Scotland. What I would suggest is if you look on my neurosymptoms website on the FAQ, there's one of the top questions is, well, there's one question which says, I've just been diagnosed with FND and all I've been given is this website, exclamation mark. The one below that is, I've got FND and I can't find anyone to treat me. So if you go there, you click on it, you'll find links to the pages on FND Hope, where they've got a map of interested centres around the UK and around the world, in fact. So that's that's a good place to start.
Okay, brilliant. And then, so Jodie's just said she's developed issues with swallowing, even very small pieces. She was told it could be linked to FND. Is this common?
Swallowing can be linked to FND. But again, you've got to be very careful here. FND patients often quite rightly get pretty annoyed that whenever they go to the doctor says, oh, it's your FND. When actually that happens to people with MS as well. So it's just kind of any chronic condition. But people with FND are very prone to getting new symptoms because it's coming from the brain's control, the body's gone wrong. So it's quite common to get new symptoms that you haven't had before and they turn out to be FND. But you're entitled to have other things wrong with you. So if you have swallowing problems that are persistent, you definitely need to see a doctor about that. But quite often that symptom is FND related. And we talk about globus, which is a symptom where people feel as if there's something stuck in their throat like a ball. And it feels like that even when they're not swallowing something. And it's really unpleasant. And it's probably related to spasm of the muscles in that area. Interestingly, a bit like spasm of muscles in Fowler syndrome.
And Fiona Kerr, it's a lovely one. I just wanted to say thank you. I had functional issues brought up about 10 plus years ago, then dropped after an Ehlers-Danlos diagnosis. I subsequently diagnosed with FND last week and was really scared. The attitude in 2013 was that I was crazy and should have no further investigations or treatment. Thanks for working to change that and making the diagnosis less scary.
Well, thanks, Fiona. That's very kind of you. Yeah, I think when you're faced with these, I'm really pleased to see that patients are also recognizing that they can have two things, more than one thing wrong with you. You can have EDS and then you've developed FND as well. And I'm glad if the FND diagnosis was given to you in a way that made you feel that it was a proper diagnosis and that the treatment might be relevant to it.
And Zoe's just said that it'd be amazing if these kind of services were available for Fowlers, which is great. And then
Chantel, I think she's saying it would be amazing if these services were available for Fowlers.
Yeah, yeah. No, they're not at the minute, I don't think. No. And then Chantel said she's urinary retention and FND. And this is a difficult one. Where does that diagnosis for Fowlers lie? Within neurology or urology? I'm having trouble with both these services helping me, as in no one wants to know. And she's been catheterized and just sort of left to it. So
yeah, it's a great question, Chantel, because the answer is it does lie between neurology and urology. And like a lot of conditions like that are between the two specialties, the patients often come off really badly because people say, well, that's not my job, and someone will say it's not mine. And that's, in a way, that's happened a bit with FND because I've said how important psychology can be, and neurology, and often we've seen a similar thing, really, that no one wanted to take responsibility. So I think it's both. I think we need urologists who know about Fowlers and know how to talk about it and what things come along with it and what the treatment is. And we need neurologists to pay and ask about and pay much more attention to their patients' bladder symptoms, because so often I meet people who say, how often do you leave the house? I go out once a week. Why is that? Well, it's my mobility, but actually it's my bladder and my bowel, and we're just not asking about it. So it's both services. And I'm sorry, nobody wants to know in your case, Chantel. You might, I don't know, if you've got Fowlers, you might want to go in waving a fact sheet at them and say, have I got this? And see if that helps.
And then there's an anonymous one. So I was diagnosed with Fowlers in 1989. My retention causes hyperactive bladder. I've learned from experience to try to train my bladder by hanging on. The retention gets worse, and I end up having to go to the loo a lot more, and I feel really faint. And then she's ends up sort of in this unpleasant spiral where she's having to go very regularly, 2 to 4 times an hour.
Okay. I mean, Ingrid, you've got more expertise than me on this one. Do you want to handle that question?
I mean, I think the big thing is that, as I said, we're so early days. You know, we're having this big meeting in September where we're bringing people from Queen Square, from France, from Edinburgh, from, you know, kind of from all around, from Ireland together to see if we can again create like basically kind of a basic thing that Jon is talking about, where like the questions we should all be asking, the basic things that we should all be ensuring for people. And then we're also then asking then the next questions as well, then trying to get sort of more and more sort of specialists so that we can try to address these things in a more helpful way. You know, I think honestly, just at the minute, we haven't figured this out yet, but we're interested. And I know that's I think we're don't want to be overly negative. Like we're really positive people and we're so excited and interested in this area, but we just would rather just take things lovely and slowly and just get them, see if we can make small changes, but move everything in the right direction a wee bit more. So that's a very fluffy answer there. Vanessa, I think, is asking us a question that's really difficult, and I think the honest answer is we're not sure. She just said people with repeated UTIs often find improvement with a yeast-free diet. Has it helped anyone with Fowler's, especially as low histamine diets help many with FND? Again, I don't think we're at that point in research yet. We're still we've just recently put out a questionnaire so that anybody that has had kind of that has stopped needing to catheterize after they've had a diagnosis of Fowler syndrome, we're trying to get as many patient experiences as possible so that we can again try to learn from those things.
I'll just chip in there as well.
Please do.
Vanessa, you said a low histamine diet helps many people with FND. I'm sure there are people who had a low histamine diet and it helped them, but I don't think that's a fact in terms of evidence. And we have to be really careful with FND because it's a very variable, fluctuating condition. And the nature of it being in the brain means that all kinds of treatments can help individual people, but it doesn't mean that they help everyone. So I think this is all about doing the proper science on it, which does take time, unfortunately.
Kelsey's asked, she said, I've got Fowler syndrome. I was diagnosed over a year ago. Recently was admitted to hospital due to dystonic reaction to some medication. Since I've come out of hospital, I have symptoms of FND. Can the trauma from a dystonic reaction cause that?
Yes, there's a simple answer.
Yeah.
So, I mean, several ways this can happen. I mean, there are medications that cause a dystonic reaction, anti-sickness pills, for example. But some people get acute dystonia just as the first presentation of their FND. So, but you're illustrating exactly what I said earlier, which is that often the trigger for FND is not a psychological event like an argument with someone. It's a physical event where you, I mean, although any physical event is also psychologically traumatic. Having a dystonic reaction to medications are a very frightening experience. But it seems that just having that experience, people's brains get stuck and they just carry on having the dystonia, even though the side effect, the actual medication's gone away. So that's really common. So I hope your FND can improve, Kelsey. Yeah.
And then Ria said, thank you very much, by the way, everyone, for these messages are really, really good. So is there any link between FND and hormones and a hormonal imbalance? Our fathers and feel it might be a hormonal issue as well as a miscommunication in the nervous system. I wonder if there's any link with that and FND. Again, so question.
Well, I mean, an interesting fact is that 70 to perhaps 70% or more of patients with FND are women. So we need an explanation for that, which could be, there's lots of potential explanations, but different hormones is one of them. Although there are other conditions like autoimmune conditions that are more common in women too.
Yeah.
I mean, I'm not a woman, so I've got to tread very carefully here. But as far as I can tell, there are many things that get worse around your periods. So it was all, you know, migraine, epilepsy, mood. So it would be kind of amazing if FND didn't get worse around your period, I would say. And hormones are going to be important. Basically, this is a complex multi-system disorder where, you know, which affects the whole person and the whole brain. So, yeah, hormones are going to be important. There'll be some genetics, but vulnerability. It's not a hereditary condition, but like heart disease, there'll be a genetic component. There'll be inflammation will be relevant. We are finding out some of these things, but we've got quite a long way to go. But at the bottom line is, I think a change in nervous system functioning is the obvious problem, and that's the one we can see. We don't need a scan or test to see that that's the problem.
Laura said, I've long-standing diagnosis of both FND and Fowler's. My gut feeling has always been that they're linked or work in similar ways. My confusion is I've been told I can't try SNS or Botox because of my FND. I therefore have a permanent suprapubic catheter and I get no support for Fowler's, which is in turn exacerbating FND. Is it common for these treatments to worsen FND symptoms?
Well, that's a really interesting story, Laura. I mean, I think first of all, I'm really interested that you say what a lot of patients say to me is that they feel like it's linked together. And then they go and see a lot of doctors who are saying they don't think they are. So I'm kind of pleased to hear you say that, because we feel it's linked as well. I must say my local experience is that our local urologist doesn't have any trouble with offering SNS or Botox to people because of FND. I think you've got to be careful with FND because people are more likely to have problems with anesthetics and side effects if people are doing things to them, particularly if it's not properly explained or if it's frightening. But I wouldn't have seen, I mean, I've got to be careful because there might be some other reason why they weren't wanting to do that for you specifically. But in general terms, I wouldn't see FND as a contraindication to Botox or sacral nerve stimulation.
Yeah. I echo that as well. Yeah. So and Linda said, I've no help. I was working full time, but now I can't walk. I have non-epileptic attacks disorder, so functional seizures, bowel issues, gait disorder, tics, spasms, and now my speech is gone as well. But she says I couldn't have coped without your website.
Well, thanks very much, Lynn. It's really, well, I'm glad it's been of some help. I know it's not much just to have information, but hopefully it does help to know there are other people. There are lots of other people out there with these disorders, and there are people trying to help increasing numbers of people in the UK and around the world. So I know it feels like it's all moving really slowly if you've got these disorders, but there has actually been a big change in the last 10 years, and I hope the next 10 years will see even more so. So all the best to you.
And Jessica says, has there been a study conducted on the success of SNS surgery in patients also diagnosed with FND? If it's okay, I'll answer that one. No.
Go for it. No, there isn't.
No, we're so early. We're so early. Danny's done the biggest study in the world. FSUK has done the biggest study in the world of Fowler syndrome. You know, this is so early days, and you know there was some really good phenotyping work at the beginning, but there's so many questions to answer.
Yeah. Oh.
I've been diagnosed with FND and Fowler syndrome with complete retention, having to self-catheterize. One doctor also mentioned a fault with the vagus nerve affecting several sphincters. Is this nerve all related to FND?
Yeah, so the vagus nerve is the main nerve that communicates from your brain to your bladder and other bits like your bowels as well. So yes, it's involved, but it's kind of the cable. So you know, there's a something called polyvagal theory out there, which is to do with, which makes it sound like the vagus nerve is the problem. It really isn't, I'm afraid. The vagus is just a cable which goes from your brain to your bladder. But that's where all these mixed up messages are traveling back and forward. So it is relevant in that sense. Yeah, but it's the brain that's the problem more than the vagus nerve, I would say.
And Lynn's just asked, would an EMG help in terms of because of the twitching episodes? But I think it's probably a neurologist and sort of making that positive diagnosis rather than a specific diagnostic test.
Yeah, EMG is not helpful for FND symptoms really, but it is sometimes used in Fowler's, isn't it? And it can be helpful, but although we're a sort of transition about that as well.
Yeah. Emma's asked a really good question here. 2 episodes of cauda equina symptoms were being prepared, ready for surgery, and then went through the scanning and it wasn't. But this has caused the Fowler syndrome. And so then she was diagnosed with FND 2 years ago, and has had seizures and also the Takasabu cardiomyopathy, which is and she's just really saying, like, look, can the cauda equina have been FND related?
Yeah, well, Emma, that's bad luck to have all that.
Yeah.
Ingrid actually did another webinar on the cauda equina syndrome. There's a whole fact sheet on that Ingrid wrote too on the Neurosymptoms website. So the cauda equina is when we worry about that when people get acute back pain and they can't pee because they might have squashed nerves at the bottom of the spine. But we found out from Ingrid's research, maybe 80% of people with those symptoms don't have a scan that really shows a cause for that. And quite a lot of them have FND. So, and we think that the bladder, the urinary retention that we see in those patients may well be like a model, an acute model of Fowler syndrome. So that's something happening suddenly, whereas Fowler's is happening slowly. So yes, you can have cauda equina symptoms that are FND related. And you've had the Takotsubo cardiomyopathy. Well, that's really interesting because that's an amazing, horrible for you, but amazing example of how stress can cause actual problems with your bodily organs. So this is where people under tremendous stress actually get sort of detectable changes in their heart. It's called a broken heart syndrome.
I mean, again, there's so many people here that could be leading the way in research. All these fantastic questions. Seska's saying, is there any link between autism, Fowler syndrome, and FND?
Yeah. Was that autism? What was the other one?
Fowler's and FND.
Yeah, great question.
Yeah. Because
this is a nice example of something that's probably right under our nose for many years, a bit like the joint hypermobility, and we didn't really spot it. But to be fair, we were spotting other things, but yes, I think that autism is probably more common than it should be in FND. Again, it's not everybody, and we've got to be a bit careful because autism and ADHD are becoming very popular. Everyone knows about them. They're being diagnosed a bit easily sometimes or with low threshold. But on the other hand, I think there are probably lots of people undiagnosed out there. And there's good reasons why someone with autism or ADHD might be a bit more vulnerable to have FND. They've got a nervous system that is different and different in ways that might make it easier to get FND. So yes is the answer to that. Autism and Fowler's, no one's looked that I know of.
Okay, brilliant. And then Chantel's also just saying that some people are actually, she went to A&E and some people actually knew what FND was, which is lovely. Somebody else is just sort of asking, Leah's asked a kind of a question. She's got Fowler syndrome and has started to have a tremor on the right side of her body. She also, however, got rheumatoid arthritis, which has recently flared up, and she's just wondering if this could be a symptom of FND.
Well, it could be, but it sort of goes back to what I said earlier. Just be careful and make your doctors be careful too. If you have new symptoms, it's a good idea if you've got FND to say, well, actually, this could be FND, but I'll go and get it checked out just to see, make sure it is and make sure it's not something else. So there's plenty of reasons for tremor, other reasons for tremor as well.
Yeah. Zoe's saying she knows a lot of others with EDS and Fowler's, but no diagnosis of FND. And she's just wondering, is that to do with nerve dysfunction, or would that also be classified under FND?
I'm wondering what she means, what would be classified under FND, the Fowler's?
I wonder if it's the Fowler's and the EDS.
Yeah. So at the moment, I mean, we wouldn't say someone with Fowler's has FND. So what we're presenting here is this rather startling, on 2 occasions we found that 1 in 4 people with Fowler's have FND, but that means 3 out of 4 didn't. And we think there might be overlapping mechanisms, but at the moment it's not classified as FND. And we know there are people out there who just have Fowler's urinary retention. Actually, they don't have lots of other problems as well. So that's the same for FND. You can have a single FND symptom and nothing else too. So these things come in all shapes and sizes.
And Zoe just also said that she's been really lucky to be offered SNS with the EDS diagnosis, because again, a lot of other people who've got Ehlers-Danlos haven't been offered that. Emma's also saying nice things about your website. That's lovely. And then Leah's saying, again, interestingly, she loses the feeling in her legs and goes paralyzed from the waist down whenever she goes into full retention. I think that is definitely interesting. And
well, these are stories that Ingrid and I hear all the time.
Yeah.
And to me, it's really, it's telling us something about how the bladder works. If someone develops acute FND, paralysis of their legs, and the bladder stops working and then it comes back again, that's telling us something really important that people may have been missing about bladder function. And that's why we need to explore it more, I think. So that's really, really interesting stories tonight you're telling us. I mean, not great for any of you, but really interesting. Thank you for bringing them.
Yeah. And Jessica's saying, is there a link between Chiari-1 malformation and Fowler's or FND?
There is a link between Chiari malformations and EDS. So people with EDS are a bit more likely to have them. I will just it's probably worth repeating that joint hypermobility, it comes in different severities, but joint hypermobility of some sort, which verges into EDS, is present in 1 in 5 of the population. So we've got to be a bit, just bear that in mind. Chiari is a change in the brain where your skull has a slightly different shape and your brain sits a bit lower. It's nearly always totally benign, incidental finding that we don't need to do anything about. So sometimes it gives you a headache.
Adela is just saying that 3 months ago she got sick with this syndrome, and I think that's Fowler's, after 8 years and seeing many different doctors. And thanks to her current urologist and neurologist, she got to this disease. However, here in Guatemala, there's no information about the syndrome and no doctor knows about it. And so she says, thanks very much to Danny and to you for this talk.
Wow. So, well, welcome from Guatemala. Yeah. So it's great to be able to reach you with a event like this. Yeah.
Yeah. And then sort of some other people are wondering about the latest sort of technological options for Fowler's. And I think I probably would say, I think that we're probably, that's more likely to be sort of Jilesh Paniker talking about that, or Maureen Paxard that Danny might do some work with on it. We can tell you about FND, but in terms of the Fowler's itself, I think just to that anonymous person, and we might add that on. And Lynn has shared again, just what John was saying, thank you so much to everyone for sharing their stories. She said she lost her 3-year-old son in 2015. I think my heart broke, and that this could have been why I have FND. Yeah. Kerry says, my daughter developed complete urinary retention in January overnight. She was diagnosed with Fowler's after urodynamics test. Jess has been diagnosed with lupus, but this was stabilizing. She developed pancreatitis. She's had more tests. She doesn't have a functioning gallbladder. She's also been diagnosed with EDS. Are there medications that cause Fowler's? And she's tried lots of different things. Yeah,
well, it's interesting, isn't it, how much EDS is coming up tonight. That's what we're saying, really, is it is much more common than you'd expect it to be, both in, well, we don't know in Fowler's, but I expect, my experience is that it is, and FND. And people who have one functional disorder are more likely to have another, including you can have gallbladder dysfunction as well. So that might be relevant. I'm glad I don't know if you said we had little success or we had a little success. I hope it was had a little success with pelvic floor therapy.
Yeah. And again, and it's, I mean, I think as well, biofeedback and some pelvic floor physio and yeah, all of these things are things I think that aren't necessarily that might be helpful again, but just maybe aren't accessible to most patients, and we need to think about whether or not that's useful or not. Danny, I see that you've gently come online to tell us that we're talking too much.
Yeah, I was going to
so
suggest
sorry.
maybe people are getting a bit tired, and perhaps
Yeah, I'm sure.
Yeah.
We're good to continue if you guys are. Maybe we could do 2 more questions and then wrap it up.
I think we might have come to the end of the chat, and I mean, I think it's been really a really helpful and an informative discussion for us as well. So thank you, everybody. It's been such a pleasure to be here, and thank you so much, Danny, and for as I said, for inviting us and reaching out. Really make this link. It's been really great.
Great. Shall we hand back to you, Danny?
Yeah.
I'll just say thanks very much as well for the invitation. I found it really interesting. I was wondering how much chat we get. We've had a brilliant interaction tonight, so thank you.
Thank you both very much, and thank you all for attending. Yeah, it's been brilliant. So many good questions, such a good presentation, Jon, and so good, Ingrid. And we're hoping to do many more of these, and more of these as with different topics. So please sign up to our mailing list, and I think you've got the details to follow FND Hope as well if you need to. So yeah, thank you very much. And that scraping is my cat in the litter tray. So thank you all very much for attending, and we're hoping to send out a little questionnaire afterwards, if on email, to everyone who signed up, and if you could pop that back, that would be very helpful.
Yeah, and if it's okay, I'll just say to Lucy, there is a recording, and to the other anonymous person, just to say that, look, I think that the key thing is that any diagnosis should be made appropriately. There's a whole long list of diagnostic things, and again, the urologists are usually very good at making sure that something else isn't missed. But thank you so much, and yeah, thank you very much, Danny. See you later.
Thank you very much.
Bye.
Okay. Bye.